Since our beginning as the Holy Cross Dispensary in 1906 and through our years as Grace Hill Health Centers, we have not wavered from our commitment to meeting the needs of the most vulnerable and disenfranchised. These are the people whose incomes are below 100% of the federal poverty level, the homeless, those suffering from mental illness and depression, the addicted, uninsured pregnant women, and babies. These patients inspire us to strengthen and expand as an organization, with purpose and passion as our charge. Among the community health centers in Missouri, Affinia Healthcare provides the highest number of uninsured primary care encounters. 42% of our patients are uninsured and 42% are Medicaid beneficiaries. More than 43,000 patients call Affinia Healthcare their healthcare home, utilizing services such as women's health, dentistry, behavioral health, pediatrics and internal medicine, chronic disease, and enabling services, just to name a few. Our board of directors and our senior executives and our clinicians and so many others are cautious stewards over Affinia Healthcare's resources, ensuring that our allocation makes a real difference. In today's healthcare climate, the typical sources of funding fall short of sustaining the level of care that our community needs. Our federal grant sources make up only 20% of our budget. We must rely on other sources of support. The depth of the need in our areas is striking. According to the St. Louis City Department of Health report entitled Understanding Our Needs, rates of poverty and life expectancy in the city are higher and worse than they are across the United States. About 700 people out of 1,000, maybe 70%, use the ER regularly for their care. Almost 30 babies out of 1,000 in zip code 63107 do not make it to their first birthday. In 63106, over 52% of people are living under 100% of the federal poverty level. And in the city overall, more than 50,000 people are without health insurance. Our role in addressing critical needs in the region is vital. The needs of our community may change over time, but high-quality health care is a constant and urgent necessity. Where will the most vulnerable in our society go for preventive care if we're not here? The trickle-down effect of the lack of care would be felt beyond the zip codes we serve. The future of health policy in our country is uncertain. Many feel that the safety net may be negatively impacted. Our support, your support, and that of others in our community can help assure key services will not be discontinued, leaving people like Kevin with nowhere to turn.
When I walked in, I didn't feel like I was being treated like someone who couldn't afford the care I was going to get. I was treated like a person. When I met Miss Angela, she changed my life. She was the first doctor that ever listened to me, and at the end of that, she told me that I was going to be okay. She was going to help me, and we were going to get there together. And that's exactly what she did. And Affinia didn't just change my life, it saved it.
I'm Alan Freeman, President and Chief Executive Officer of Affinia Healthcare. High priority needs in the areas we serve are those you've heard today: addiction, depression, diabetes, heart disease. These are among the few. The time is now. We need your support to help guarantee healthier futures for our patients and their families.